everyone, I'm Kelly, and today we're going to practice proper wound care. So I'm redoing my video today, so some of my supplies are reused, but in a normal situation everything would be packaged up and in alignment, so you would never reuse the equipment. So the first thing I'm going to come in is I'm going to assess the room I'm in and see if everything's okay in the room, and I'm going to say, "Hi Mrs. Smith, how are you today? Can I get your date of birth?" She'll tell me her date of birth and her name, and then I will go ahead and tell her what I'm doing, which is I'm going to be changing her wound and cleaning it. And then I'm going to ask her what her pain is, and she says her pain is about a 2, so therefore I would not need to administer meds beforehand. Okay, so to start with, I am going to try and maintain as much privacy as I possibly can so she feels comfortable. And in this situation, since this is a mannequin and other people have been using it, she doesn't have a lot of gauze on, so I'm just going to take it off when I take it off, and we're going to pretend like she had all the normal packaging on. So the first thing I'm going to do is I'm going to practice good hand hygiene. I'm going to remove my rings so my gloves do not get stuck. And normally before I come in, I wouldn't have them on, just so none of them get stolen or anything. So yeah, I'm going to take off my watch, and then I'm going to put my gloves on, and I did hand hygiene. Put my gloves on. Okay, so then I'm going to, like I said, provide privacy for her, and take off the wound care, and I'm going to have my biohazard bag hanging at the side of the bed, and that's already there before I had even started anything, so that's where that's going to go. But since we don't have one, I'm just going to set my dirty supplies on the floor and pretend like there's one there. So I'm going to remove everything and kind of assess and just throw away the biohazardous stuff and look at the wound and assess it and look what I need to chart. And the wound is red, and there is some tunneling in it, and it's kind of meaty looking, and it looks like it's gonna start healing soon. So I would put that in my charting. Okay, so now I am going to go ahead and take off my gloves and throw those away. And then I'm going to measure. I'm going to put back on gloves because normally I would have to measure the wound. So I took those off beforehand, so just hand hygiene. And then now I'm going to measure. And you're going to measure length and width. And the depth comes last when I'm actually cleaning and putting, rewrapping the wound. So I'm going to measure, and you're going to measure in, you're going to measure in centimeters, or you can measure in centimeters or inches. Just note which one you're doing. So for charting, so the patient, so the nurse or the care team knows. So centimeters is 10 centimeters for the length, and the width is 3 centimeters. Okay, so I'm going to put that over here, and it's not going to touch my sterile field. And now I'm going to take off my gloves, my second pair of gloves, and perform hand hygiene. So I'm going to wash my hands. Okay, and still remaining some privacy for her. Okay, so now is the time to get the sterile field ready. So I'm going to take, so now is the time to get my sterile field ready, and I'm going to make sure that I pour my water before I do my sterile field, pour the water in the cup and make sure that's all good and set before I set up my sterile field. Okay. So I'm going to pour in and sterilize the lid, and then I'm going to go ahead and pour this in there and just pretend that I did that. Okay, now I'm going to set up my sterile field. So, in a normal situation, like I said, this wouldn't slide out because I don't have all my equipment. It's all being reused just for learning and training purposes. And I'm never going to turn my back. So always make sure that my back is facing so nothing contaminates. And in this situation, the colored side would go down, and also in this situation too, all the edges of your sterile field are considered contaminated. So it's okay if I touch those, okay? So I'm just gonna move this over corner by corner, making sure I don't contaminate anything, making sure nothing touches, just kind of straighten it out a little bit. And that goes in the trash. And then, now I have all my other supplies. Like I said, since I'm redoing this, not everything is kind of open, and in the perfect world, this wouldn't be open, and it would all be closed, and I'd just be removing everything, opening it up. So, there you go, and I'm gonna throw that away in my trash because it's not biohazard. So I'm gonna just gently remove my gauze, making sure I'm not touching anything with my hands that aren't sterile. And then, like I said, all the edges are considered contaminated, so it's okay if I touch them. And then, like I said, these wouldn't have been touching the bed. Like I said, since I'm redoing this, it's not all in perfect condition, so I'm just gonna pretend that I took those out and nothing touched. And now the hard part is I'm going to put on my gloves. Like I said, these would not normally be opened, so I'm going to do the best I possibly can. And I'm going to throw that away. And like we keep saying, corners are always the ones that are considered contaminated or unsterile. So, the inside of the glove is considered unsterile, so I'm going to go ahead and not touch the outside of the surface and gently put those on. And then I'm going to scoop my fingers, always rechecking and always checking to see if my field is staying sterile, so I'm going to slowly put those on. And now, not touching my skin since my gloves are sterile, I can then pull up my gloves and make sure those are okay. And then I can touch them and make sure they're fitting and everything's good at that. Okay. And now I'm going to